Hi, my name is Dr. Kiara, and today I'm going to walk through a particular real-life scenario that happened during a busy ward round. So as soon as I hear the conversation going on between the nurse and the patient, my first and immediate step is just to quickly dash to the computer, check the EMR and verify that there is that documented allergy, and very swiftly going in saying, apologizing for interrupting the conversation or whatever that's going on between the nurse and the patient, and to just express my concerns that this patient may have a particular allergy to the said antibiotic, and perhaps it would be wise to pause the administration of the medication, calling aside the nurse gently and also reassuring the patient that we do not want to do any harm to her. So just to give us a moment to check, make sure that the nurse halts the procedure, and perhaps if she could come back and remove the medication from the patient's bedside at that point. And then the next thing would be to follow the hospital's medication safety protocols, which is to look at the 5 rights of the medication administration, making sure was it for the right patient, is the dose correct, is the drug that was prescribed correct, the correct route and the timing, and then again cross-check it with the allergy that has already been documented. So now we have this in the EMR, but also go back to the patient, ask her what are the exact, if she recalls the exact name, if that name is familiar, which like she had highlighted, and what are the reactions that she had to it. And so I can confirm this, and then my next step would be to escalate this to reporting for a near miss according to our incident reporting system. And then I would notify the medical officer in charge of the team to provide and to get an alternative antibiotic prescribed for the patient. So this is to make sure that we adhere to the national patient safety standards, as well as our hospital's SOPs and good clinical governance. And when addressing with my colleague, I would of course want to do it privately, respectfully, and highlight that the aim of this is for teamwork with no point for blame, and giving him reassurance that I know it's a busy morning and things can be overwhelmed and easily overlooked, but I just happened to come across this particular conversation, and I had concerns, so I quickly checked and I've confirmed that there is a severe documented allergy, and reassure the patient that we caught it early before anything was done, and perhaps we could double check the next time it comes, whether it's for a different patient or even within the same particular patient. So I want to enhance a blame-free safety culture that also maintains the dignity and avoids confrontation with my colleagues. My approach is very much in line with the ethics and safety principles that we are encouraged to adhere to: non-maleficence, beneficence, justice, and as well as professional duty. And this also reflects patient safety first principles as well. Long-term wise, to reduce similar incidents from happening in the future, definitely would encourage consistent allergy verification, patient documentation, make sure it's updated. I would also perhaps want to suggest a micro teaching or an allergy checks, especially with high-risk medications, and naturally reinforcing the habit of double checking for allergies before we administer, not just by the doctors but also by the nurses themselves. And similarly, not to take it lightly. If the patient mentions something, always come back and check, let the doctor know, check again. It's no harm checking rather than doing damage control. And then if possible, like in the EMR, we have a notification ready on the top there that alerts that there is some drug allergies going on. But if that is missed, perhaps we can consider like patients who have an allergy, regardless whatever type it is, their wristbands perhaps are of a particular color. So when the nurse confirms on the wristband if this is the patient that they're supposed to administer the medication to, the moment they see this color, they know that, oh, there is an allergy, and that would also highlight them to check back for an allergy and cross-check with the system as well. So this can strengthen and improve our workflow. And of course, I can anticipate that perhaps my colleague may answer defensively, and it's a busy environment, it sort of limits time for discussion, and this is in our field for psychiatry, it probably came from an instruction from another discipline, so having to cross-check and get a new plan from another discipline is easier said than done. But just to again reiterate the non-maleficence aspect of this, and reassure that this is neither fear or need to reprimand. That's not the intention here. So I remain calm, making sure I remain calm, supportive, and patient-centered. Also making sure I enhance and I keep my communication with my colleague, my staff, the nurse, my support staff, as well as the patient as well. So yeah, that would be my approach. Thank you.